Hi guys, this is Dr. Samaliazad. What I'm going to do today here, I'm going to talk about the musculature that covers the neck area as well as the muscles of the facial expression that you can see. I'm going to describe them on these models. Let's start on this part here. That we start from the top. The first one here is known as the frontalis belly, and it has a occipitalis belly in the back. This is known as occipitofrontalis muscle with the aponeurosis in between that is connecting these two structures together. From there, as we come down here, right in the upper part between the two eyebrows, this is a procerus muscle that brings the eyebrows medially, and from there we're going to get to this muscle that kind of circle around the eye. This is known as orbicularis oculi. Then from there, as you come down in this section, you can see the nasalis muscle. Then from there, there's another muscle that wraps around the oral cavity known as the orbicularis oris. From the orbicularis oris, there are a couple of muscles that are kind of important. First one is this little muscle here that comes from this section all the way here. This is known as the zygomaticus minor. Then this one here known as the zygomaticus major. Right next to it, there's another muscle sitting here, which is known as the levator labii superioris. From the corner of the mouth, there is another muscle that extends toward the ear, known as a rhizorius. And right in this section, this big tissue mass of muscle sitting here, known as the masseter. Then from the corner of the mouth, we have this muscle here that is kind of angled down, known as a depressor anguli oris. Then there is one that goes from the bottom of the lip, come down, known as a depressor labii inferioris. And of course, right underneath it, you have the mentalis muscle. The other muscle also that's here is known as the temporalis muscle. That is a part of the muscle of the mastication. Some of the muscle that you might be able to see in this section here also is going to be these two muscles here, which is the medial and the lateral pterygoid muscles in this part. Then this is a muscle which is a posterior belly of the digastric that comes right, if you look a little bit deeper in this bottom part, you can see this is a posterior belly of it that comes and attaches to the anterior belly of the digastric. The other muscle that sits right next to it, it goes from the styloid process of the temporal bone and attaches to the hyoid bone, is known as the stylohyoid muscle. And the muscle right underneath here is known as a mylohyoid, which sits right underneath the tongue region. You come a little bit lower, you have this big mass muscular tissue right here. This is a sternocleidomastoid that goes from the sternoclavicle and attaches to the mastoid process. The next muscle also here is this sheet-like structure known as platysma that sits right and cover right underneath the neck. If I remove this sternocleidomastoid from this one, now I can see some of the other musculature that are located there. This one is known as omohyoid, which goes from the shoulder to the hyoid bone. Then you have my scalenes, anterior, middle, and posterior scalenes that are sitting here. And right next to it, on the back side, I'm going to have my levator scapula. Then, as you go to the back, as we were there, you can see the trapezius muscle that sits right on that part. If I remove part of the trapezius muscle, now I can expose better the levator scapula and the spinalis capitis and the semispinalis capitis. You can see them a little bit better. Then there are a couple of muscles here. This is a rhomboid minor and the rhomboid major here. We also can see the supraspinatus muscle here, parts of the deltoid muscle in this section. So if I remove this deltoid part, you can see part of the infraspinatus muscle right on that section. Coming in front of the neck, there are some muscles that we need to talk about. The first muscle is this muscle here that extends from the sternum and goes all the way up and attaches to the hyoid. This one is known as the sternohyoid muscle. If I remove that muscle, then underneath it, I'm going to get these two muscles. One is going to go from the sternum to the thyroid, so this one is known as the sternothyroid, and the other one is going to go from the thyroid all the way to the hyoid, so this one is known as the thyrohyoid. And of course, this is the omohyoid that you can see it's sitting right on that part. Then, on the front, we're going to have the pectoralis major. When I remove the pectoralis major, underneath it, you can see the pectoralis minor. Then you have, right then here, you can see the external intercostal, and this one is going to be the internal intercostal muscles located there. So you can see those things also on this one. We can recap that one quickly. This is the frontalis, temporalis muscle, orbicularis oculi, zygomaticus minor, zygomaticus major, levator labii superioris, nasalis, procerus. Then orbicularis oris, depressor anguli oris, depressor labii inferioris, mentalis. Then you can see here the masseter and also the buccinator and temporalis there. You can see the sternocleidomastoid, omohyoid. You can see the anterior, middle, and posterior scalenes, and the levator scapula here, and parts of the other tissue here known as the spinalis capitis. We can see them a little bit better here. You can see the levator scapula, scalenes, anterior, middle, posterior scalene, and also we can see the semispinalis. I'm sorry, this is the spinalis capitis, and this is the semispinalis capitis, and here rhomboid minor, rhomboid major, deltoid muscle, and the trapezius and the latissimus dorsi, supraspinatus, infraspinatus. This one here, teres minor and teres minor, teres major, and of course the deltoid that was sitting right on top of it. And front part, you can see the sternocleidomastoid, pectoralis major, pectoralis minor, external intercostal. This is the internal intercostal muscle, and this one is external intercostal muscle. So this is just a recap for all the muscle of the facial expression, as well as the muscle of the anterior posterior of the neck, the superficial one. I hope that you found them to be helpful. Thank you for watching.